Hello, my name's David Kidney. I'm the Chief Executive of the UK Public Health Register. So it's not easy to give a brief overview about what public health is in the UK, but I think my starting point would be to stress that the people who work in public health are multidisciplinary and they work population-based. So if you think of a doctor deals with the individual patient who presents in front of the doctor with an illness or an injury, well, for people in public health, they look at whole populations. So a whole population might be newborn children and their parents. It might be smokers. It might be the residents of a street that's heavily polluted. And public health people address the ways in which they can avoid ill health and promote well-being for the whole population so that they are healthy, they feel that they have good well-being, and also a very key part of public health is try to address health inequalities. So why should somebody study public health? I think the starting point is a very old saying that's as true today as it's ever been, which is that prevention is better than cure. And what I see is that governments around the world, not just here, are realising how important prevention is in the field of health. And that's because there's a growing recognition of the value of health, not just the value to an individual in, say, quality of life, or the community of the individual, quality of life, but also in economic performance, both for the individual to have a good job that's not interrupted by ill health, and for governments and countries about the economic performance of the country. So economic performance is just as important as kind of individual health. If you think of some of the serious issues that we're facing, people in public health are right there dealing with them. So if it's the foreseeable health impacts of climate change, or the growing impact of the obesity crisis, or if it's new deadly threats emerging like coronavirus, the COVID-19. People who work in public health are right there, front and centre. The skills that I think that people in public health have that make them successful start with being highly ethical. Public health is a very ethical practice. After all, the people who work in public health are trusted with many, many people's personal data. They have to work with lots and lots of other organisations, so they have to agree to kind of work as a team player, and all of that requires ethical standards. So if you want to be in public health, you need to personally have very high ethical standards. And another strong sense in public health is a sense of fairness, because public health is about people's right to health. It's about tackling inequalities in our society for the benefit of those who have the poor health because they're the least well off. So you also need to have a very strong sense of fair play if you want to work in public health. But obviously at the core of public health is very strong technical skills. You have to be skilled in epidemiology. You have to be able to be good at interpreting data and what it's telling you. And you have to also be good at whole systems working with other organisations. And so for all of those, what you need is a good education. And that's why places like UCB exist, to provide a good education for people in public health. You're looking for a job in public health, what careers are available to you? My experience is that there's a huge variety of jobs in public health, and to me that's one of the attractions. I see that they're in all sectors, so in the public sector, private and voluntary, and I see that the job descriptions and the responsibilities are very varied. And I think all of those are, to me, quite interesting challenges. But of course, if you've got those strong technical skills and a good sense of ethical value, then you should be able to attract quite a good salary as well, which is a kind of a practical attraction of public health. But for me, the top of the tree in terms of what's the attraction of working in public health is that ability to work with others to improve the lives of people at scale. So you really can feel a sense of satisfaction in public health if you've been able to do something with your career that improves the lives of whole communities, not just individuals. But what I would say to people, if you're values driven in your life and you want that to carry through into your career, if you want to do something with your career that improves other people's lives and well-being, then if you've got that strong drive that you're going to do good for others, then I think public health is the career for you.